When nature calls, you must answer. But when nature calls several times in a short time frame, well, then you may have a problem. 30% of men and 40% of women in the United States live with overactive bladder problems. So tonight's Healthy You explains why this happens and why it may be a sign of something a bit more serious. Sitting atop the porcelain throne at least 4 to 8 times a day should be a part of your normal day-to-day routine. It's only a problem when it reaches more than 8 times a day and night. Then you may need to talk with Dr. Paul Benson about having an overactive bladder.
Typically, it's going to the bathroom too often. Sensation of just you need to go all the time. Possibly a sensation you can't empty your bladder when you are actually trying to go to the bathroom. Frequent urination with urgency, can't hold it. As soon as I gotta go immediately. And some people will develop even leaking of urine.
OAB is mostly seen in men and women over the age of 40, but it's not a typical symptom of getting older. And the causes are not only physical, but they can be mental as well.
Sometimes it even can be behavioral problems. So techniques, things that we do during the day, things that we eat or drink, they can be a large component of why women and men start to develop problems. Women tend to have it more commonly than men. Men, it seems to be associated with more of enlarged prostate and other men's health concerns when comparing to women.
OAB is also a common symptom of prostate cancer. According to the American Cancer Society, prostate cancer is the second leading cause of cancer death in American men behind lung cancer. Yet men have more of a fighting chance treating this disease by asking questions and getting tested early.
The important thing with prostate cancer screening is that it needs to be what we call shared decision making. So men need to come in and talk with their urologist to determine what is involved with prostate cancer screening, potentially some of the benefits and the risks associated with screening. Then you can move on.
It's recommended that men over the age of 50 get yearly blood work and rectal exams done, depending on their medical history and their demographic.
We know that it is a very high risk factor in people as they age. Your risk of having prostate cancer goes up. African American race is at an increased risk of prostate cancer. And we also know that people that have first-degree relatives, so like fathers or brothers with prostate cancer, are really the ones that need to be in and closely monitored for potential prostate cancer in the future.
While it may be up close and all too personal, getting a prostate exam for men and getting a gynecological exam for women to diagnose the source of your OAB is essential.
You need to be seen and have a good evaluation to make sure that we know what we're dealing with.